citizens
60
are
and above.
also, which indicates to senior citizen, and in few years back, maybe a decade or so, the senior citizen was not supposed to be economically gainful person, but now the senior citizen are also economically gainful person. Even in rural India, they were asked to, as soon as they become grandfather, they were asked to leave the agricultural work, and they used to take the lead the life reservation. But these days, since we are having university in rural areas, so I saw each day that all the senior people, maybe they continue to work till the end of the life, till the last day of the life, and they advise the younger generations what to do and what not to do, because how much pesticides is to be given, or how much fertilizers are to be given, all those things they advise. So they are still in rural India also. I find that they are very much active, and they are contributing to the economy of the family and ultimately to the economy of the country. And as you know, that Society for Empowerment has a repository of all the senior citizens, and we publish the number of vacancies where it is available for the senior citizen in the magazine which we publish each month. And we have some Society for Empowerment has some interesting data also, that how when the senior citizen are re-employed or employed as a senior citizen, we call it employed, we do not call it re-employed. So when they are employed, then with from some places we get complaint also, and so from that I have some suggestions also. I have got some suggestions also. So all those things that we will be discussing. But first of all, I would like to request Professor Kavita Sharma ji to
Well,
come out with her presentation.
thank you so much for having me here. As you know, I also tried to drop off, but mercifully the fever has gone down. So I don't know good or bad, but I'm here.
No, no,
So
it is good that your fever has gone. So that part is good. Now,
okay.
so far the presentation is concerned, you have a very long experience, so you will definitely make some good remarks.
So as I was also, this was also an occasion to think about it, since I belong to the same age group. And I was thinking that growing old is not for the faint hearted. It's not for cowards. It requires a lot of courage to grow old. It's not everybody's cup of tea. Now, in India, I think that we are neglecting our old people because we have a policy, but the implementation of the policy is leaves so much to be desired that they are falling under in the cracks of that policy. Now, one reason also I think is because we have such a big young population. India has the world's largest workforce because it has the youngest population. 50% of population is below 25 years of age and 65% is below 35 years of age. So of course everybody is interested in this young population. Not that they are doing brilliantly well either, but anyway the focus becomes getting the demographic dividend rather than on the older generation. So this overshadows the problem of people who have got old or are getting old, and the numbers of old people is rising. One reason of course is longevity and the falling mortality rates. So that gives us a span of life. In fact, I was talking to somebody yesterday and I said, I don't know whether science has given us a boon or it has given us a curse, because now this person had just come from the memorial service of somebody who was 97 years old, and she was living all by herself. Although her son also lives in Delhi, she was also in Delhi, but her son moved to Gurgaon and she was living with servants and she was found dead. So I'm not quite sure whether this longevity is really something which is unmitigated bliss. Anyway, the Youth in India report of 2022, put out by the Ministry of Statistics and Program Implementation, recognizes that there is a shifting demographic that is going on. Um, Initially, young people between 15 to 29 years of age are supposed to grow, will be growing. And then in the second half of 2011 to 2036, that means we are there, the window of opportunity is much nearer, is going to close much faster. In this period, the population will first increase and then start to fall, and therefore by 2036, the young population, which was 26.6% in 1991, rose to 27.9% in 2016. It is expected to decline by 2036, and it will be 22.7%. So there will be a drop of over 5, almost 6%. The flip is true. The elderly population percentage will go on increasing. It increased it was 6.8% in 1991. It increased to 9.2% in 2016. It is expected to reach 14.9%, which is almost 50%, 15% by 2036. This is all, I've taken these figures from different reports, but this is corroborated by the government itself in its report of the Technical Group on Population Projection for India and the States, 2011 to 2036. Another forecast is that by 2026, by 2061, every fourth a person in India will be over 60 years. So we have to start planning now. We are already in 2024. And so 20 years later, this is what was going to happen. Among the elderly, also, some are more vulnerable than the others, especially elderly who are in the unorganized sector. Now, Professor Narayan was talking about how they work till the last day of their life, and but the unorganized sector employs 90% of India's workforce. So now there are already signs there that of great vulnerability of the elderly in this area. Uh, this can be seen through the statistics of the Mahatma Gandhi National Rural Scheme, that NREGA. Uh, in 138.54 lakh individuals uh, who were 61 and above availed of this scheme in 2020 to 2021. Now, this number is increasing. If you see the whole gamut from 2018 to 19, there were 93.8 lakhs. From 2019 to 2020, there are 100.08 lakhs. From 2020 to 2021, it is 138.54 lakhs. What does this indicate? I'm sure it has risen further by now. It indicates that the elderly people are having to fall back on safety nets like Narega because they have no one to care for them in their old age. And they have no financial security. So they also don't have enough options or opportunities to be able to earn something. Now, the much touted old age pension that we have. Currently, 25 lakh persons are covered by the National Pension Scheme under the unorganized sector. That is only comes to 0.6% of the size of informal sector. So even if you take away the young people, then also so many are out of the net. Now, this demography of the elderly can only rise. Now, the individuals in the cutoff in the informal sector, as you yourself pointed out, Professor Narayan, have no age of retirement. So they go on working. Formal sectors have an age of retirement, and you get either a contributory provident fund or you get a pension or something to tide you over. So what happens is that low wages plus income insecurity leads to individuals having to work on the daily basis till their dying day. Otherwise, how are they going to eat? Also, a lot of construction is going on everywhere. Now, the first time when I was at Hindu college years and years ago, for the first time, I must have lived a very sheltered life. I found the labor, the nakkas or nakas or whatever you call them, where the labor collects and the contractor picks up to hire them. So they collect there, and but they don't get hired because it is the young people who dominate. The older people, nobody wants to hire them because the perception is, well, they have a lower physical strength. I see my own physical strength from where it was to where it is now. So lower physical strength, and for the contractor, it is not feasible. He says, no, no, I will not risk my contracts because of these, and the younger can do more physical work. I also, for the first time, had this experience. There used to be a fellow who used to be painting the college for years and years since I was a student. When I became principal 2 years later, they said, we don't want to keep this person. I said, why? Because they has grown old and he takes a too long a time and he is not as efficient. So we need to change. And I said, this guy has spent 40 years painting your college. Yes, then whatever audit problems and why did you keep so many people and so on and so on. So elderly come to these labor markets, but because they have no one who will care for them, it's very humiliating, and therefore they have to work to cater for their needs. But they find it harder and harder. Their need grows greater and greater, and they find it harder and harder to get hired. They can't get hired. They can't do the heavy weightlifting required. Then the informal sector, because it has no retirement age and the elderly work for as long as they physically can, even if their wages are low, they get something. And also, if work is available on a specific day, if it is not available, they just stand around and go away. There's no one there. You were talking about silver economy. Have we really created a silver economy? I don't think so. I don't think so. When I go to US, well, they have social security, but they have a silver economy. There's a lot of things that the old people do working from home, but we can't. And there are problems. It's not just a policy, there are also problems. So, therefore, the net nutshell is that the elderly are in constant need of work, but their market value keeps decreasing. They find it tough to compete with the younger people. And in any case, the younger people themselves are very resentful of older people taking their place because they themselves are in an unemployment crisis. So really, they cannot also accommodate the older people. Now, for the first time, it was in 1999 that the National Policy on Older Persons (NPOP) it was one of the probably earliest policies directed at elderly population. Currently, we are under the Atal Vayo Abhyuday Yojana, and this also was, I think, known as a National Action Plan for Senior Citizens, or NAPSRC. Now, there are many schemes under this. One of them, the two major ones are Integrated Program for Senior Citizens. And the second is State Action Plan for Senior Citizens, because the central government can't do everything, and therefore the state governments also have to pitch in their share to help. But the uneven development of states, the uneven income that the states earn, also makes the implication is that it impacts the elderly people. Now, Now, one of the things that it says is intergenerational living ensures active and productive agency. Yeah, sure. But now with the changing scenario, the changing, I don't know, modernization, westernization, whatever it is, globalization now, I'm one of the globalized people with nobody at home with me. So then what happens is, how do you ensure intergenerational living? And then every generation, all the three generations at least that live together, have to learn to adjust with each other, which they find very, everybody with the rise of individualism is more interested in themselves rather than accommodating the others. Then the older people also, their skills become very outdated, and even to figure out how to move around in the home and how to use the gadgetry at home becomes impossible. This is, I'm talking of urban people. So the scheme talks of regional resource and training centers which have to be spread across the country. There are also two targeted pension schemes under this, which are focused on the informal sector. One is the Pradhan Mantri Shram Yogi Mandhan. It focuses on people of age group 18 to 40 years with a monthly income of 15,000 rupees or less. And then when they, at the age of 60, they can start drawing 3,000 rupees a month. The second is the Atal Pension Yojana, which is focused on poorer workers, and they have to again contribute whatever some part of their earning between 18 to 40 years, and then at 60 they can start drawing a pension of 1,000 to 5,000 rupees. Now, it, as it is, the money that they earn is so little, even when they are young, and then to expect them to put everything, and then for 20 years forget about it, and then 20 years later you try to draw your pension. I don't think it, not given the state of India's bureaucracy and everything, nobody has any faith in all of this. So this idea is a no go, no this thing. It will not fly, because some 20 years later, who will go to redeem it, how will they help, and who will be there, nobody knows. And so they will have to struggle on a daily basis to find work. Now, HelpAge India has a study, Bridge the Gap study 2022, which deals with giving the realities of how the road is very long for any meaningful assistance to elderly people, so that they have a life of care and dignity. Now, their findings are that among the India's elderly, 47% are forced to ask money from their families, which they find very demeaning. I think all of us belong to the age group. And if we have to go to our sons or daughters to say that I need support to be able to survive, we find it very demeaning. 21% are forced to work for a living. 57% face immediate financial insecurity because they don't know where the next thing is going to come from, whether their family will support, not support. 45% find their pension, whatever they get, inadequate, and 38% of people of this age group said that they find that there is a lack of employment opportunities. Therefore, this indicates that there is a paucity of options which the older people can exercise, and therefore their independence goes, their control over their lives goes. So we need many things. One could go on, but we need many, many things. One is the national plan must be added. There must be an addition to this national plan to provide special focus on the healthcare of the young. Now I saw so many. Everything seems to keep talking about the healthcare of the young, of the old people. But you need geriatric specialists. You need nurses, who will care for, who are specialized in this. You need home care people. I mean, I had a mother who was bedridden. She died at 88. She was bedridden for 3 years. And so, what to do? How to find help? That was a big thing, and help which will not kill her when I'm asleep at night. So then you also need equipment, low vision equipment, You need knowledge of how to make the bathroom, how to make the floor, and everything which is safe for them. There is hearing impairment, how to provide all this equipment for them. Locomotion becomes a great problem. Wheelchairs, it's not just wheelchairs, it's also sticks, and it's also don't provide a wheelchair and then expect them to be carried around. Motorize the chair, teach them how to use it so that they become independent. I have seen so many older people I go to US every year. I've also been to Russia. They sit in motorized wheelchairs and they're very independent. Their footpaths are such that the wheelchair can go on them smoothly. They can do their own shopping, and that becomes an outing. They can go and buy their grocery, and they are not so depressed lying there by themselves with nobody there. Now, so you need all these things before any help can happen. Then also, you need a provision so that in the informal sector where they work, or most people work, and this is a subcontracted thing by the corporate. um, and those workers who are or belong to the subcontracted unit, they are not covered under whatever are the corporate norms that have to be followed for their workers, but they are providing all the work also, so they have to be treated as if they were part of that corporation, and not just casual informal units which the contractor uh, has uh, has used to provide services. Now, 67% according to Helpage India uh, of elderly people have no health insurance. In fact, till a couple of years ago, I found it very hard. It never occurred to me to do a health insurance for myself because I was covered under CGHS, but CGHS has collapsed. So I said, okay, let me do a health insurance. No scheme was there for my age. They said, no, sorry, we are not going to give you health insurance. Now things are gradually improving, and 52% of people have no healthcare options. So they fall prey to all kinds of quackery, especially in the rural areas. But again, I know they work in, and I've been talking about older people working in physically demanding works. They have not been trained to do anything better. So they have to go and do physically demanding work. But it is not correct for them to be asked to do that kind of work because they work, they do this physically demanding work in the informal sector, which is very poorly regulated, and the safety environment of that in that sector is an additional threat to whatever else they face anyway. Therefore, we require regular reskilling. Even if the person doesn't have literacy, that person can be to be skilled to do something. So upgradation of work can take place, and as the work upgrades, then your physical labor decreases, and your skill with your fingers or with your mind or whatever becomes better, and that would alleviate the problem of very back breaking physical work that they do, and this would actually create a silver economy. But instead of we just constantly talk about it, to my at least I haven't found a silver economy. In fact, discrimination begins at the age of 60 when you're told now your time, sorry, go now. So therefore the focus has to be on the elderly from 61 or 60 onwards, to provide protective nets also, like hospice. If somebody gets cancer, is terminally ill, where is this person supposed to go? There is no hospice. There is no healthcare which will provide the opportunity. I mean, which family has the wherewithal today to go on caring for long-term illness of the elderly? They don't. I remember my own uncle. He was a lawyer, but he gave up working, and then he got a sore, and that was rotting. But he would not. His children are doctors. He would not show it to them. Why? Because he didn't want to trouble them. He thought they were too busy, and till his daughter saw him limping and said, "What is this?" And then she said, "How are you walking?" and gave and treated him. So, therefore, such protective nets also have to be there. The primary reason for the elderly working, therefore, are distress, and they are under further distress in informal sector. They lack money, they lack savings. Many of them give it all away to their children because they are, they want to see their children with a better life, and therefore in their retired life they lead very miserable lives. We need to provide equitable and inclusive retirement for both the formal and informal sector. The pension plan can have different options when you will enter and when you will exit, and then it can be calibrated according to that or those number of years that you made a contribution, to see how much you will get. Not that you just keep contributing and forget it for 20 years and then you go to some clerk sitting there and try to get money. So the private sector needs to be involved in this. They are the beneficiaries of the informal sector. They rely on these workers of the informal sector, and then apart from their own laws that they have to follow for their worker, they must follow the same laws for the subcontracting units, and they must be included. These people in the corporate schemes, they, as I said, different pension options have to be provided. CSR has to be directed towards the elderly, and 90%, there's a pressing need to look after the workers in the informal sector and the rural heartland. I mean, in the urban areas, the problem is different: loneliness, depression. I know a couple of people in my own sector, which is the poshest sector you can come across, have died. There was no one there. Couple of days later, the body was found. So maybe the families have to be incentivized to look after the elderly. Otherwise, they don't also have the bandwidth to be able to do so. And central government, state government, corporates, and individual munificence all has to come together to be able to provide for the elderly. Well, that's all I have to say. Thank you.
Okay, thank you very much, Professor. You have given very valuable suggestions, and I think that all those needs to be incorporated in the policy and programs of the government. Society for Empowerment will try for it, and what society is doing, that we are trying to provide the entertainment to the senior citizen living in the rural part of the country, because they have no source of entertainment. So we thought that we should do it, and for their health, we are organizing health camps
I know.
twice, twice a month. So that is, these are the things. So if like, gradually the NGOs should also come out, uh, and they have to think for the senior citizens. All have to think together, and otherwise it's the senior citizen today in a very pitiable condition. As you said that someone may die and people will come to know about their death only after 3 days or 10 days or something like that. So that situation we have to think about how to come out of it. Now we have another important speaker, Professor Anil Prasad. He had been to different universities abroad, and in India also he is doing work, some good work. So I will request him to make his presentation, and after that we will conclude.
Thank you very much. I am very happy and I feel privileged to be invited in this roundtable discussion. And for this, I thank you, Professor Narayan sir. And I have been a part of this Society for Empowerment, and I am very happy that I have been connected again. And it is a kind of learning experience for me because the topic itself was very challenging to me, senior citizen and challenges to silver economy. And I I learned many things from Professor Sharma that the situation is not very bright. I agree with her that it is not easy to grow old, and I quote one Hindi two lines of a Hindi poem by Arun Kamal when he wrote this poem after meeting Frontier Gandhi. न विवशता न थकान न स्यापा हो तो जिंदगी की नोक हो बुढ़ापा. But since we are uh, men of literature, and literature has been a source of inspiration, and lots of poems have been written on old age, I think there is a change of perception in looking at old people now, because I myself a senior citizen, and I work in different capacities. Uh, I could sit at home, but I work on Radium, and we are going to begin uh, classes for disadvantaged students from 1st of May, because it's very important to give to give a helping hand to those who wish to study, wish to learn, but they do not have resources enough to go in the right direction. So, first of all, uh, just as I said, that there is a change of perception about the old people. Just yesterday, I read in the newspaper that a 6-year-old Argentinian woman wins Miss Universe, breaking the stereotype for the province of Buenos Aires. So things like this, people who are aging, they are coming forward and they are doing things, and that's why people have come out with the term that was coined in 1970s in Japan, the silver economy. It's a new kind of paradigm that has emerged uh, today, and in today's world, it is a kind of system of production, distribution, of consumption of goods and services. Because some of my friends who have been watching, they asked me to explain it, because people never heard of the term silver economy. I myself uh, knew very little about it uh, since the invitation to speak on this subject I received. So it is a system of production, distribution of consumption of goods and services, aiming at using the purchasing potential of older and aging people. Now, I consulted a book, a very recent book published in 2024 by Routledge. It is written by Agatha Nimzik et al., Silver Economy and Aging Society in the European Union. And it talks about Europe and the silver population of Europe, and in terms of information technology, telecommunication, financial sector, housing, transport, energy, tourism, culture, infrastructure, local services, and long term care of the senior citizens. Now, the world has a changing perception of the word old. It has now new connotations different from the past. Now, taking the words of W. Yeats, the old man is not a paltry thing today, a tattered coat upon a stick, but it is a senior citizen, and it creates demand for production and experiences, and that's how the silver economy, the term, has come into being. Now, the growing and changing demand of the aging population for the world is now facing a challenge that was not faced before, and this existence of a long-lived population. I think the people are living longer today and they are healthier. Uh, in spite of certain ailments they have. And this popularity of growing population of uh, uh, today is joining hands with digital technologies, and that is very important. And that's why some people call it economics of aging, or aging no economics. So what is the future of silver economy? uh, I agree with Professor Sharma that in India it has not shown its future in the proper light, in spite of the programs which have been put forward by the government of India. Different programs are there. Some of the programs uh, like Sacred and Sage and Life Circle and Lassie are there also to help senior citizens. But uh, the data has been already furnished by the previous speaker. But I think that India, the silver economy is estimated to be about $7 billion, uh, dollars, and this will make the elderly population a distant set of consumers, and it will create new opportunities for the senior citizens and to live a productive and vibrant life for economic growth. And that's why I quote Tennyson's from Tennyson's Ulysses, that it is never too late to seek a newer world, and the world that is before us would be very can be seen in the positive light. Now, uh, there is another concept I would like to talk about, that is there to bridge the gap of that is one topic that was given to us, that uh, how to bridge the gap between the policy and the things which are going on. There is a French sociologist whose name is Pierre Bourdieu. He coined a word, cultural capital. So when the cultural capital, that is education, intellect, style of speech, dress, even physical appearance, would be combined with social capital, that is social relationship and social networking, which is dwindling very fast today, and it is based on goodwill, fellow feeling, sympathy, social intercourse, and trust. Then I visualize that there would be a new kind of society that will emerge, and I am quite uh, positive about it for the betterment of humanity. There will be some changes uh, that will be perceived, but one has to work very hard in order to bring about those changes. Now, the two things which are there in the topic, the challenges and opportunities. So, what are the challenges there with the aging population? For example, the challenge is, as it has been nicely put by the previous speaker, that aging and the aging population has lost sense of purpose, and this of sense of purpose, because of financial insecurity, difficulty with mobility, because mobility is a very important aspect of aging. If people are not mobile, if they cannot move from one place to another, if they do not have good health, they cannot enjoy other things. So access to healthcare services and preparation for the uh, end of life, how, because all of us are going to the path to the end of our life, and it is the greatest challenge, the mobility, and there is a gradual deterioration. So mobility is crucial for active aging, and if there is no active aging, there won't be socialization, there won't be a community life, there won't be access to necessary resources, and people cannot live an independent life. And if they cannot live an independent life, there would be there won't be enhancement of quality of life. I just would like to give one example. 2 days ago, there is a festival of play going on in the House of Variety in Regent Cinema in Patna. And the play of Parishwarath Redu is being staged. There is a story of Renu Panchlet, that is the Petromax. I am associated with Human Rights Association Bihar. The president of Human Rights Association is 84 years old, and he was very much interested in watching this play. And he is a very hard worker person. He went with us and he watched it and he came. So his mobility is intact. His health is good. He has kept himself very active after retirement. And that's why his quality of life is better. So for a senior citizen to keep good health is very important. So how to keep good health? Then the question of access to healthcare services and the other things, the care provided by the family or by the state, that comes into picture. So these are the problems. Now the problem is that the approach should be interdisciplinary, it should be interactive, and it should be a combination of different components like healthcare, healthcare facilities, policymakers, urban rural planners, because the senior citizen has a different kind of uh, uh, this perception. The one who lives in the urban area and the one who lives in rural area, he has different kind of constraints. So all these things should be a kind of, it requires interdisciplinary approach to tackle this problem. So these are the challenges. And what are the opportunities? Now, learning to live after 60, it's a continuous process. And I, I, I was invited in on DD Bihar in a program of senior citizens. It is called Achhe Vat. And there was a topic given to me for senior citizens. And I, I, I reiterate the thing I told them there, because I said that give a message to the people, the senior citizens watching. Now, the first thing is that there should be adjustment in the mindset. I have my senior uh, teachers living in Patna. Their children are in the US and they never went there because they think that they can't be happy there. So they suffer isolation and alienation. So there must be adjustment in the mindset, doing new things, exploring new ideas, to be a role model, to inspire others. For example, book reading. For most of the people, book reading is now not a habit since we have cell phone and we are reading on cell phone. Gardening is not a choice. So if book reading is not there, gardening is not there, by changing the mindset, one can read, one can do e-book reading. One can be computer literate, because I have a program for senior citizens for making them literate digitally and using social sites to express your views. Now, this kind of uh, doing exercises, physical and for physical and mental fitness, and to ward off anxiety, a lack of confidence, loneliness, forgetfulness, because people are suffering from dementia, they have lot of anxiety, lack of confidence is there because of that goes with the growing age, and they have to mix with younger people and not only talk to them about their past, but they also have to, as I said, change of attitude. They also must listen to younger people so that the younger people could sit with them and there should be a kind of interaction. So these are the uh, challenges and opportunities which are very important to tackle with. Now I come to the uh, deliberations which are mentioned there, and one point that is very important that I found very important is that in order to bridge the gap, there must be empowerment of senior citizens in the area of digital divide. We all know what is digital divide. It is a gap that exists between individuals who have access to information and communication technology and those who lack access. So, those who lack access, they should be helped to have access to internet, Wi-Fi, broadband. But there are real problems, as ma'am said, that there are real ground realities which should uh, be taken care of. For example, low literacy, low income level, geographical restrictions are there, lack of motivation is there to use technology, lack of physical access to technology is there, digital illiteracy is there. So each individual should have equal access regardless of gender or income level. The second point is mental health. Many people, uh, when they are growing old, they have certain life changes that take place and impact their mental health. For example, losing a loved one, many other kinds of setbacks, and they cause isolation, depression, anxiety. So now they should be taken care of. The young people should be motivated to talk to them and to help them. The government agencies and the healthcare workers, they should help them and they should do counseling. So these are the remedies. The other kind of remedy that I have experimented with is the meaningful social activity. In Gita, we have a slok that says that if we are unhappy or sad in Sanskrit means that one gets degraded because of show, and that's why our ability to do things uh, becomes low. So art, talking, sharing, expressing oneself, it is very therapeutic and it has healing effect. So we should do something to help those senior citizens who are suffering from these kinds of ailments. And we can help them to connect with others so that they can significantly improve their mental health and their life could be satisfying and they can have a certain amount of quality of life and they can have peace and satisfaction. So these are certain things which I found they are very useful and what they need, uh, in fact, what they need at the end of life. Many people wish to work. Many people wish to work. They are very happy. We are looking for a librarian because we have a library in which Wi-Fi is free and there are many books. And we are looking for a librarian, not a full-fledged librarian. We are looking for a senior citizen who can be given this job and who could be very happy spending some 3 4 hours during the day. So this kind of thing can be this kind of thing can help them, and if they have this kind of support, and if we can talk to them, and if we can listen to them, and because all the senior citizens they need family support, they need home safety, they need medical health, they need mobility and cognitive health and personal hygiene, and they also need uh, meals They are very simple things, but they need meals twice or thrice, uh, the simple meals in order to survive, social interaction. They need sharing and caring, and that is very important. Now, the next item is climate change. When climate changes and there is heat, air pollution, sound pollution, heavy rainfall, it affects Syrian citizens. They have stomach problem, they have nervous and respiratory problems, liver and kidney problems, skin problems. So uh, the policymakers should create suitable environment and proper housing, proper spacing. There should be low curb, and the road should be different so that if they are not able to walk, they can uh, they can conduct themselves in the in a safe way. So the policymakers, the government, the elder population themselves should have positive outlook for the new population who are just. I would like to quote from Tennyson's uh, Ulysses that who are made weak by time and fate, but strong in will to strive, to seek, to find, and not to ill. Thank you.
Thank you very much, Professor Prasad. You have made a very good observations and presentations based on your real experience and also on based on the different books. In in Indian situation, what we find that in ancient India, the senior citizen they all had a very they all enjoyed very well social positions, and in family they were respected and they were considered as the teacher for the younger generations. All these stories, educative, inspirative stories and incidents were narrated to the children. They used to learn from their grandchildren and grandfathers and great grandparents. But now that situation, because of so many changes, the social situation and cultural situation has changed, has much changed. So people have become individualistic, and joint family is no longer a reality. Though there are some exceptions of joint family, but in most of the cases, the joint family is gone. Even in rural India, that is the reality that people prefer to live individually. At the most, they prefer to live with their son and grandson, but not beyond that. So this is the reality, and when this is the reality, then the aging people number is also going up and up, increasing. And when it is increasing, then there is a conflict between the local social institutions and the aging people. So how to minimize that conflict and make the life livable for senior citizen is a great challenge, not only for the senior citizen but also for the society as such and the government as such. As both of you discussed about the government programs and policies, but both of you mentioned that it is inadequate, and I also feel that it is inadequate because the policy is there. But when I was in NHRC, then I had a lot of experience of people, senior citizen who were suffering from the mental health, and
Yeah.
there is and it's very difficult for a family to or for an individual to come out that they have some mental illness or there is some mental problem. That mental illness is not because of any kind of physical ailment, but because of their living as an in isolation. They were just living as an individual, and there was no seldom they were anybody to interact with them. I had a very those days I had few cases with me, and the government institutions also neglect such cases, whether it is a human rights commission or government ministries. They think, oh, it's old people. They have some. some problem and they do not take it very seriously. So that is that point. The mindset needs to be changed. So for that, the orientation is required because as I told you, that Society for Empowerment publishes each volume that where the senior citizens employment is available and they can go to somewhere we recommend it. So few days back we got a complaint from one of the organization where we have recommended a person that now the senior citizen does not think that does not obey his boss because they are much junior in age and they are and they think that we are very senior people, so we must get respect and we must have some sort of leisure period comparatively more than what the younger generation or the younger people have in the office. So that creates a lot of problem. That is because when the younger generation joins a service or any institution, then for them there is a training program that they are properly trained in the institutions about the institutions or about their services like the government services or even in the corporate sector. That kind of formal training for 2 weeks or 3 weeks is there. But when senior citizens are hired or when they join, then there is no formal training for him. That is also required that there must be made aware of the situation that this is the situation now. These are the younger people, how to adjust and react or respond to the questions of the junior people. Because so all those things are that need, but that such program is absent with us, and I think that gradually we will have some more programs on this, and then the government may come out with a training program for those who are there are such institutions who are playing a role of platform in providing services to the senior citizens and also trying to uh, provide them some sort of outlet where they can interact with the people or where they can do something for their recreation, for their entertainment, and all those things. That needs to be structured. It is not, even today, it is not there. And both of you are very right that silver economy is still far away in case of India. That that we have to see how it can be achieved. We have to give a solution, a recommendation to the government that how it can be, how silver economy can be attained in India also, and it is done there. So we have so many programs, but some of them are only as a formal presentation in government documents, but not in reality. And the senior people really feel very difficult to run to the government offices to get the pension, whichsoever whatsoever amount is provided to them by the different ministries or by the government, by the state government or by the government of India, or but we also made compulsory for the corporate sector that they also have to take care of their employees who retired from their institutions, and they also must have some programs. We are trying for it. We are working for it. We are having interaction with some senior citizens, some such corporate sector, but I do not know how much the Society for Empowerment will succeed. But we are just trying to make a example so that the other may follow then. That if you continuously if you are following it, then there may be some such institutions may come up. Then there is also some uh, fast change in policy plan and program, which the senior citizen are not made aware of. Generally, the policy programs are available on digital, say, the digital technology, and the senior citizen are majority of them are not aware of that kind of digital education. They do not have. So this is a lot of. So let us think that government may go for their training also digital education, as Professor Prasad had suggested, that digital education is equally important. But this needs a by organizing or having one webinar or two webinars problem we cannot solve it. For this we need a regular uh, and concurrent continuous process. We have to undertake this kind of exercise. Then probably we may have some sort of input to suggest that this is the real situation. And from here, we brought a group of senior citizens to this level. We have a plan to have an entertainment section in our institution in close to Gaya. So that if that works, if we start now, we are trying to start it maybe in a very shortly. Then we will have a something that some examples we will have that after 3 months we may be able to say that if we are providing them a regular food and a regular entertainment, then what kind of change we observe. Because in rural India, they are sometimes senior citizens are termed as the old man, madman. They are that they have gone insane. Whatsoever they are saying, no, their younger generation is not listening to them. So all these problems are there, and I'm very much thankful to both of you that you addressed the real situation, and we will again meet in our next programs or so. So thank you very much for coming and participating. Namaste.
Thank
Thank you.
No.